Hello, my name's Katie. I work at Wellbeing Services in the south of Glasgow and I'm going to talk through relaxation during COVID-19 pandemic. So here at Wellbeing we understand that as a result of the COVID-19 pandemic we may experience more worry and anxiety than we usually do. This is completely understandable and a normal reaction to a very stressful and an unusual situation. We may be experiencing loss of roles and hobbies, as well as time socialising with family and friends, and this might ordinarily help us cope with stress and anxiety. Our fight, flight, or freeze response is a protective mechanism that we've needed to survive. When we were cavemen or women, we would need to react if we saw a lion. Our flight, fight, or freeze response would kick in, so we could run away, fight the lion, or play dead. Feeling anxious or stressed is our body's natural response to feeling threatened. It's an alarm system which helps us deal with danger. Our breathing rate increases, as does our blood pressure, heart rate, muscle tension, sweating, state of mental arousal and adrenaline flow. A lot of the time we don't need those survival responses, so relaxation helps to decrease that adrenaline response, to let it go. So how does relaxation help? Relaxation can reduce tiredness. If you can manage everyday life without excessive tension, it should help with this. It can improve performance in work, sport or music, as this can be raised through self-awareness and the control of tension. Relaxation can reduce pain, as that can often be the result of tension, for example headaches and backache. Relaxation can help you to cope by raising your pain threshold and reducing the amount of pain that you're sitting with. It can increase your ability to cope with stress, as relaxation helps you reduce the effects of stress and to breathe effectively through it. It can improve sleep by allowing you to be calm and peaceful, and improve self-confidence by increasing your self-awareness and ability to cope with daily life. It can also improve personal relationships, as it's easier to relate well to other people when you yourself are feeling relaxed and self-confident. Breathing is an important tool to help you relax, so I'm going to talk through how to do some deep breathing just now. Our out breath releases tension in the chest muscles, allowing our muscles to release their tension. Breathing is much more effective when we use our diaphragms rather than our chest muscles, so I'm going to ask you to sit comfortably in a chair and place a hand on your belly. Take 2 or 3 large breaths and imagine that there is a balloon in your belly. It should inflate when you breathe in, and it should deflate when you breathe out. Practice so that it's your lower hand on your abdomen that moves as you breathe in and out. People often think that their tummy goes in when they breathe in, but the reverse should be the case. As you breathe in, your belly should move out. When you're feeling tense or trying to relax, try breathing out a little bit more slowly and more deeply, noticing a short pause before the in-breath takes over. Don't exaggerate the in-breath, just let it happen. You might find it useful to count slowly or prolong a word such as one or peace to help elongate the out-breath a little. You can do that to yourself or you can practice it out loud. Another useful tool to help relaxation is called progressive muscle relaxation. Our bodies respond automatically to stressful situations and thoughts by becoming tense, and the opposite relationship also works. A good way of relaxing the mind is to deliberately relax the body. In a progressive muscle relaxation, each muscle group is tensed in turn, and the tension is then released. This relaxes the muscles and allows you to notice the contrast between tension and relaxation. Relaxation should be enjoyable, so if any part of the exercise is too difficult, skip it for the moment. And if you have any injuries, you might wish to leave that out in part of the exercise. To prepare for relaxation, what we usually do is to ask individuals to lie on their back, a firm bed, a couch, or on the floor. We ask that people's heads and necks are supported with a pillow or a cushion, or alternatively people can sit in a comfortable chair with their head well supported. We ask that people close their eyes, but only if they are comfortable doing so. We usually go through a recommended sequence with progressive muscle relaxation, starting with people's hands and asking them to clench their fists and then the muscles in their arms and unclenching in time with their breath. We then move on to people's legs, lifting their legs, their stomach and chest, back muscles, neck and throat, and then finally face, and asking people to clench the muscles within those muscle groups and then release them in time of the breath. There's a more detailed progressive muscle relaxation script that's available on the Wellbeing website in audio form, and that will talk you through how to do a progressive muscle relaxation at home. Another tool that's commonly used for relaxation is visualization. Visualization is also called imagery. People can start this by sitting in a comfortable position and focusing on their breathing. Close your eyes and pay attention to areas of tension in your body and releasing this tension on your out breath. When we're asking people to try imagery, we ask them to engage all of their senses in this exercise. I'm going to go through a safe place imagery that is used commonly in our practice. I'm going to ask you to imagine a place where you feel calm, peaceful and safe. It might be a place that you've been to before, somewhere that you've dreamt about going to, or somewhere that you've seen a picture of in a magazine or on the internet. Try and focus on the colours in your safe place. Can you notice the round sounds that are around you? Or maybe the safe place that you're in is silent. Pay attention to the smells that you notice there. Focus on any sensations, whether that's the earth beneath you, the temperature, the breeze, the air, and anything else that you can touch in your safe place. While you're in your safe place, you might choose to give it a name. It might be a word or a phrase that you can bring back that image anytime that you need to. You can choose to stay in there a while, just enjoying the peacefulness, but you can also leave whenever you want to, just by opening your eyes and being aware of where you are now. That's me talk through an example of safe place imagery. Try at least one of these exercises daily, and I hope that you found them helpful. Remember that just like learning to cycle or to swim, these things take time and practice before we get them right and feel the full benefit. So don't feel disheartened if the first few times you try these, you're not sure if they're for you. Try to keep going. For more information, please visit the Wellbeing Services South Glasgow website. If you're struggling during this really difficult time, then contact your GP or the crisis service via NHS on 111. Alternatively, you can also call Samaritans on 116 123 and try to discuss your issues with a loved one if you're really struggling too. Take care.